The prevalence of diabetes is increasing across the country and in particular communities, low-income communities, and especially in populations such as African Americans, Native Americans, and Latino Hispanic people. It's a serious national problem. The Alliance is a very exciting project that's working in several ways to reduce disparities. One is the service level, actually helping people who are at risk for diabetes or who have diabetes to manage the condition more effectively. The second is to learn how to take evidence-based approaches and translate them into real-life settings. And the third, at a national level, is to work with agencies and organizations so that we can collectively increase our influence and ability to bring about needed change. Without the foundation of collaboration, nothing important can happen. It's a fundamental dimension of progress, and the Alliance is placing great importance on ensuring this collaboration occurs. Camden has gotten 3 major health systems to collaborate in sharing data so that they can identify the people who are in urgent care most often and target their services to those individuals.
And we ask the providers to refer to us the people that are lying in the emergency rooms. In 1 year, someone went 113 times, and over 5 years, someone actually went 324 times.
The Camden Coalition program has this diabetic collaborative program, which has been excellent and helpful to us from the emergency room. We now have a referral, which we never had before.
In Memphis, there are over 100 churches that are targeted in this project.
The Merck Foundation's funding of Diabetes for Life means everything for the Memphis Shelby County community. There were not funds specifically designated for this kind of comprehensive approach in the neighborhoods of Memphis.
We've really probably done a great job on education. I think we've gotten to the head, but we haven't really gotten to the heart or the soul. Diabetes for Life is a group of people who can get to the soul.
As you think about the African American church that has always been the beacon of light and hope for social justice and social change.
The Baylor program has managed to integrate fully into the clinical team community health workers.
Claudia, she has played a very important role, especially in those first days when I was diagnosed. She spoke to my wife, my son, and they explained to the 3 of us my food, my diet, my exercise.
The Merck Foundation grant program enabled us to take the community health worker job and embed it inside the healthcare system.
Other people in the healthcare team really have embraced the diabetes health promoters and see their value.
One of the things that I didn't realize was under the umbrella of the care that these folks were going to provide was that they would pick up the phone and call me when they had our patient in their office. It really became this nice collaborative effort to get these patients the best access to care that they need and deserve.
The Chicago project has identified diabetes champions in 6 clinics in the south side of Chicago. The clinics become models for expanding this approach to diabetes care throughout the clinical care network in the city.
This effort to try and improve our community is also an effort to try and create a national model for how we might try and address and reduce diabetes disparities amongst people who come from different racial backgrounds and class backgrounds and economic backgrounds and those kinds of things.
Diabetes is an issue. Health is a civil rights issue of our time with respect to the African American community. It is encouraging to see public-private ventures that help the community to address this issue of diabetes.
Save-A-Lot is really excited about this entire project. We see coming into our stores as providing a living classroom, where they're able to actually come into the stores and take the things that they've learned and see how they play out when they're doing their normal grocery shopping.
Wind River is drawing together diabetes care and education programs from across the 2 tribes participating in the Alliance and from across the health care facilities at the Wind River Reservation.
I have one doctor that I check with, and he said that they can't believe how good everything's doing. So I'm just pleased with myself and hope that they do have more classes for other people.
In receiving the Merck Alliance grant, we have collaboration with the state, with the county, the Indian Health Service. So it has been a really, really great collaboration.
The Alliance approach is investing in proven leaders, clinical leaders and community leaders who have the best possibility for bringing about system and policy change.